Have you ever wondered why chronic diseases like obesity, diabetes, and heart disease are so rampant, even though we live in an age of advanced medicine? Here's the truth. It's no accident. The systems meant to keep us healthy and nourished have been corrupted for profit. This isn't just speculation. It's a well-documented story of manipulation from John D. Rockefeller's influence on medical schools to the rise of ultra-processed foods engineered to addict us. The good news? There is a way out. And in this episode, we'll explore how our healthcare and food systems became so broken and what you can do to reclaim your health. So let's get started. Are you ready to revolutionize your health and reconnect to your primal self? Welcome to the Primal Shift podcast. I'd like to thank Peluva for sponsoring this week's episode. Peluva is the brand behind my favorite zero-drop minimalist shoes with the distinctive five-toe design that allows for correct dynamic movement of the foot when walking or running. The latter is impossible when toes are encased in a single box, even a white box. I love my Peluvas because they give me the most authentic barefoot style experience, but with sufficient cushioning to use them all day, even on hard surfaces. Peluvas are also incredibly stylish and I really like how they look. I've been using my Peluvas during intense CrossFit workouts, while walking the dog, and even during a recent 8-day trip to Disney World, and they've been unbelievably comfortable. They feel like walking barefoot on a putting green. Now you can try a pair of Peluvas with no risk by visiting peluva.com. That's peluva.com. Make sure to use code KUMMER for 15% off your first pair. And now back to the episode. The story begins in the early 20th century with John D. Rockefeller. Known as the father of the pharmaceutical industry, Rockefeller saw an opportunity to turn oil byproducts into medicine. But there was a problem. Medicine at the time wasn't centralized. Holistic and naturopathic practices were common, and medical education emphasized nutrition and preventative care, how it should be. But Rockefeller needed to change that. In 1910, his personal lawyer, Abraham Flexner, authored the Flexner Report, which reshaped medical education in America. The report labeled holistic medicine as pseudoscience and called for a standardized curriculum focused on pharmacological and surgical interventions. Rockefeller then poured millions into the creation of medical schools like Johns Hopkins and the University of Chicago, ensuring they adopted this new model. By the 1930s, medical schools were heavily influenced by pharmaceutical interests. Doctors were trained to prescribe pills, not prevent disease, and the concept of treating the whole body diminished in education. This shift set the stage for a healthcare system built on managing symptoms rather than addressing root causes, a legacy we are still living with today. That's the reason why if you go to the doctor, they're only concerned about treating the symptoms and often don't even ask or inquire about the potential root causes of what might cause those issues that you're dealing with. Now fast forward to the 1950s and another pivotal figure, Ancel Keys. His lipid hypothesis claimed that saturated fats and cholesterol caused heart disease. It was a seductive theory, but the data didn't add up. Keys had been criticized for selecting data from countries that supported his hypothesis while ignoring others that contradicted his findings. And that's how the 7-country study came about, where he cherry-picked 7 countries that fit his hypothesis and ignored all the other from the 22 countries in total that didn't fit. And despite the contested research, Keys' hypothesis gained traction, thanks in part to government backing and media promotion, much like today. The result? Saturated fats like butter and lard and tallow were vilified, and cheap industrially produced seed oils, typically used as engine lubrication, like soybean and corn oil, were promoted as quote-unquote heart-healthy alternatives. These oils are high in omega-6 fatty acids, which then, when consumed in excess especially, can promote inflammation and disrupt the body's balance. Yet they became a cornerstone of the low-fat dietary guidelines introduced in the 1970s. And the real kicker? These guidelines were backed by food companies eager to profit from cheap, processed products. By the 1980s, the manipulation of food took a darker turn. Facing declining cigarette sales, tobacco companies pivoted to food. Believe that, tobacco goes into food. Something you probably didn't know. For example, R.J. Reynolds acquired Nabisco, and Philip Morris bought Kraft and General Foods. These companies applied their expertise in addiction to create ultra-processed foods engineered to override our natural hunger signals. Enter high fructose corn syrup, a significant concern for our health. Derived from corn and heavily subsidized by the government, high fructose corn syrup became a staple in processed foods. And unlike natural sugars, excessive high fructose corn sugar consumption can disrupt metabolism, promote fat storage, and increase oxidative stress. Today, a significant portion of children's calories come from ultra-processed foods. And these aren't just unhealthy, they are designed to be highly palatable, leading to overconsumption and a cascade of chronic diseases like obesity, diabetes, heart disease, and everything else in between. Meanwhile, the healthcare system was evolving into a profit-driven machine. Consider this. A substantial portion of medical spending today goes towards managing diseases, not preventing them. Why? Because prevention doesn't generate revenue. There is no money to be made with dead people or with healthy people. Perpetually and chronically sick people is where the dough is. And that's why we have the medical system and the healthcare system, or the sick care system really, that we have today. And doctors are often siloed into specialties, trained to treat symptoms rather than root causes. Medical schools, influenced by pharmaceutical funding, emphasize drugs over lifestyle interventions, and clinical guidelines, shaped by organizations like the American Diabetes Association, have been critiqued for downplaying the role of diet while promoting pharmaceutical solutions. Now here's a concerning example. The ADA has faced scrutiny over its dietary guidelines and recommendations, with debates about the influence of food industry funding on its positions. Instead of addressing the root causes of diabetes, the system often relies on medications like insulin to manage the conditions. But let's talk about what this means for real people. 74% of Americans are either overweight or obese. That's absolutely nuts. What's even worse, 50% of adults have either prediabetes or type 2 diabetes. Half of the freaking population in this country have some sort of insulin resistance. That's absolutely mind-boggling. Also, autism rates have jumped from 1 in 150 in the year 2000 to 1 in 36 today. And Alzheimer's disease, now called type 3 diabetes, is at an all-time high, with early onset dementia cases increasing in recent years. These aren't just numbers, they are lives. Children are facing health challenges and families are struggling with medical expenses while seeking solutions that don't often address the underlying problems. So where do we go from here? Well, the first step is to recognize that this system was designed, but it can be changed. And here's the hard truth. We can't wait on leadership at the state or federal level to fix this. I mean, it's great that we now see a change in perception and a change in how we approach healthcare and trying to make America healthy again. And all of that is great. But change won't come from the top down. It starts with us, the consumers. Every time you shop for groceries, eat out, or buy supplements, you're voting with your dollars. So support local farmers, choose whole foods over processed junk, and prioritize quality over convenience. And here is how we can fight back. Number one, educate yourself. Learn about the real causes of chronic disease, metabolic dysfunction driven by poor diet and lifestyle. And I know it takes a while and it's boring to read scientific research and you'd rather have someone else tell you what's real, but you have to educate yourself. Nobody cares more about your own health than you. Don't delegate that, not to me, not to someone else. Do your own research and try to figure out what makes sense and what can be true and what can absolutely not be true. Number two, demand transparency. Hold food companies and healthcare institutions accountable. Ask questions. If something looks fishy, ask them. And ask them to show reports and studies and lab tests, if need be, to make sure they are transparent and honest with the labeling and with everything in between. Number three, return to the basics. Prioritize real food over ultra-processed junk. Choose butter over margarine, grass-fed meat over processed snacks. Go back to the basics, how humans have been eating for a very, very long time before we became fat and obese and diabetic. Number four, focus on prevention and not treating symptoms. Small changes like walking more, getting sunlight, and eating nutrient-dense foods can drastically reduce the risk of chronic diseases. And if you have a medical professional that you work with and that person doesn't ask you simple questions like how do you sleep, how do you eat, how is your stress, how much do you exercise, if those questions are not asked when you go to them to ask for help, look for another medical professional because they're evidently not equipped with finding and treating the root cause, and instead are only interested in selling you drugs, making them legal drug dealers, and that's not going to help. This isn't just a health crisis. It's a battle for our future. And the story I told you today isn't just history. It's a call to action. Our food and healthcare systems are broken, but we have the power to change them. It starts with awareness, but it ends with action. And if you want to learn more about all of that and really dive deep into an entire discussion, I encourage you to listen to or watch the Joe Rogan episode with Dr. Casey Means and Kelly Means. They talk about that in depth, all of the stuff that I mentioned, not all of it, but most of it in very great detail. So check that out if you want to learn more. It's a super interesting discussion coming from professionals who've been trained in medical school and exactly how it works, and who know that what I told you today is truth and I didn't make any of that up. So with that, enjoy. Let me know if you liked that episode. Share your feedback. Share it with someone who needs to hear this, and I hope I'll see you in the next one.
Ever wonder why humans are the only species that struggle with sleep? In our next episode, we sit down with sleep expert Nick Stewart to unpack why we stress so much about something that should be effortless. Are we sabotaging our own rest? And could the key to better sleep be as simple as not worrying about it? Tune in. This one's a game changer.